let's get started.
Well, welcome everybody to another Do Better podcast. I hope you guys are blessed today. I hope that you enjoy this podcast because we're going to have another informative podcast about what happened to my mother, the side effects of clindamycin, and hopefully help you guys know more about this and be proactive when it comes to this antibiotic that the dentists are giving out. So I want to welcome Anthony Laguna. How you doing, brother?
Good to see you. I'm doing well. Good to see you. Hey,
Welcome,
man.
Anthony.
Good to see
You've
you.
been on Anthony since what? Years. How many?
Early 2000s,
Early
man.
2000s.
Yeah.
Anthony is a teacher.
Yeah.
Powerful teacher, not just teacher in the school, but in ministry, powerful teacher. I told him like before, and I'm telling him again, I'm a little jealous of him sometimes because he's out there doing this thing. I'm like, man, I wish I could speak like you. But I guess that comes with
I
knowledge.
wish I could sing like you.
There you go. Praise God.
Oh,
Praise
praise
God.
Lord. We have all different gifts, right?
Yeah.
Amen.
So, Gabriel, it's good to see you again, man.
Good to see you too, Rob. It's an honor here to be working with you
Thank you.
and in helping everybody, to be aware of this situation. It's just been going on forever, but now it's like, okay, somebody's got to
Yes.
step up and speak up.
Yes.
And thank you.
There are other organizations out there that are doing the same thing, but as far as I know, there are different states. I think there's one in Canada that started a nonprofit because somebody in their family had passed away from C. diff as well, from antibiotics. And so they're doing their thing out there, but thank the Lord that we're in Orange County right now trying to make a move. I'm going to be going to the Orange County Supervisory Board meetings recently next week and start speaking about this stuff. And there's a lot of things happening, man, a lot of great things happening. Once they come into fruition, which they're already happening, and I see it in my hand, we'll keep you posted what's going on. But a lot of good things are happening. So today I want to talk about, guys, this is going to be called curbing overuse of dental antibiotics proves daunting. Overuse. Overuse means too much.
Way too much.
Not needed.
Way too much.
Mm-mm.
Unnecessary.
Unnecessary, not needed. This one starts off with, it says right here, it says about once a week, Erin Kennedy, DMD, NPH, treats patients with complex dental infections who need antibiotics. She writes these prescriptions with care, the word care, because remember up here it says, what does it say again? It says daunting curbing. So she says she writes it with care. She writes these prescriptions with care because she knows the harm they can cause. In 2015, Kennedy's grandmother suffered multiple infections with a superbug called Clostridioides, right? They said that right. Difficile, also known as difficile or C. diff, which my mother passed away from, which is associated with antibiotic use. Now, once again, we need antibiotics. We'll talk about again later on what you can do to help support your stomach when you take antibiotics. Watching a grandmother battle infection, which kills nearly 30,000 people in the United States each year, was really devastating, said Kennedy, Assistant Dean for Curriculum and Integrated Learning at Kansas City University College of Dental Medicine in Missouri. I was able to see the impact of antibiotics on her quality of life, said Kennedy, whose grandmother passed away later that year from causes unrelated to C. diff. It wasn't C. diff that killed her. I remember thinking we need to do this differently, not just for her, but for everyone. So that's why we're here. Bringing this attention to you guys because, like I said before, you go to your dentist, especially like my mom went to her dentist and been going there for a long time. So you trust your dentist, like you trust your doctors, right? Take this antibiotic. We're going to have a surgery. Trust me. They cut you open. God willing, it all works out. But we trust our dentist and we go there and they say, here's the antibiotic. You go to the store, you get the prescription done and you're just taking them down. But there's more, I believe, that dentists and doctors should now do. Here's my opinion, guys. I think that now when you go to a pharmacy and your doctor gives you something, there needs to be more information like, this is what you need to do to prevent. Right? I believe that. This is what you need to do to prevent. Start eating this, start eating that. No more just here, take it, go. I know at the pharmacies they ask you, do you want to talk to the pharmacist? And most people say, nah, I trust my dentist. I trust my doctor. But it's more than that nowadays. Because right here, if you read again, her story is talking about unnecessary antibiotics you don't need. You may not need it. Right.
Jeez Louise.
Rob, I think something that plays a part in this is that doctors or dentists, they want to cover themselves.
Yes, okay.
Because they'll say like, I had a dental surgery procedure not long ago, and it's like, take this just in case.
Right.
Right? Because you don't want to get an infection, right? And then it's like, hey, you didn't give me antibiotics, and then who knows what happens from that, or maybe they're afraid of a lawsuit or something like that.
Right.
So I think the overuse comes maybe from even fear of like, I need to cover myself, you know,
It's possible.
take this.
But once again, in the articles, it talks about actually, dentists, do you already need that one?
Sure.
Do you already need this? Can I, like I said before, how about some salt tablets in water? Can I gargle with salt? You know, don't just take it. Ask the questions. I know we're going to talk about your story in a second here. She said, I was able to see the impact of antibiotics on her quality of life, said Kennedy, whose grandmother passed away later. Doctors and dentists have been aware of the risk of inappropriate prescribing antibiotics for decades. In addition to causing C. difficile infections, overuse of antibiotics increase the risk of antimicrobial resistance. Overuse, I mean, basically, we keep taking them antibiotics, it's going to be, our body's going to resist it, right?
Yeah.
And that's no good. So I'm not saying you don't have to take antibiotics. Just ask the question, do you need the antibiotic? I'm not against antibiotics at all. Like I said last time, I had a sinus infection. I took some and I feel better, right? But I down my yogurt. I down my cabbage. I Googled everything I need to do to protect my stomach, so I don't get something like this. So that's what we're going to try to teach you guys. Yes, Mr. Wells. I went to the store the other day, bought me another jar. I got a fork and just started chewing it down. It's also good for your stomach. They say for ABS, if you have issues with the stomach, it's good for that too. So the whole point is, I'm not here, and my family's not here to say, hey, don't take antibiotics, but be smart about it. Be smart about it. Ask the questions. Some people may not want to know the side effects. Well, how about don't ask about the side effects? How about say, what can I do to make sure my stomach, I don't get difficile or C. diff to make my, so you know what I'm saying? That's all I'm trying to say here. And I understand when you're saying that maybe they're afraid of lawsuits and they got to do what they got to do, but question it. Doctors and dentists have been aware of the risk of inappropriate prescribing. See what it says? Doctors and dentists have been aware of the risk of inappropriately prescribing antibiotics for decades. In addition to causing C. diff infections, overuse of antibiotics increase the risk of antimicrobial resistance (AMR), which occurs when bacteria involved to become difficult or impossible to kill. AMR contributes to an estimated 5 million deaths worldwide. So, am I saying the fact that resistance is killing 5 million people a year? AMR contributes to an estimated 5 million deaths worldwide each year. AMR.
Worldwide.
Because we're sucking down too many antibiotics.
Imagine that, you guys.
Some people just say, I'm going to doctor, I'm going to go to urgent care, get some antibiotics. Okay. Me, when I have a sinus infection, I do everything I can before I go get the antibiotics. Rinse, sinus spray, hot towel my nose. When I praise God and cry, it drains. It's just facts. So what do you want to say?
No. I mean, again, if you just, how can I say it? Like, if you just take any advice from anybody that supposedly was supposed to be taking care of it, how are you supposed to protect your own health if you're not putting your part into it? My problem is this, that we are not using our brains anymore for things that when it comes to our health. We're always just letting the computer or letting call the doctor or anybody, that doesn't even have some kind of title, and you're not watching out for yourself. So if you're not doing that for yourself, well, how do you expect to also protect your family? That's what I'm worried about.
I mean, antibiotics is one thing. What about the type of food you eat? Let's talk about that. Eating healthy. You say, think about for your own health. Eating healthy. Stay off all the sugar, the sodas, all that stuff. That's part of it too, right? Because at some point when you're eating, when you continue to eat unhealthy, you may need to go to the doctor for an antibiotic because the doctor's going to tell you need to fix this. Here's some medicine, but why not avoid that if you can? So, although doctors are prescribing few antibiotics, a SIDRAP news investigation has found that dental antibiotics use has remained stubbornly high for years. In a 3-part series this week, SIDRAP News is investigating why overuse of antibiotics remains common in dentistry, as well as steps that policymakers and consumers can take to reduce the risk of harm. I'm already working on contacting policymakers, and like I said, when I have an update on some stuff, I'll keep you guys posted. Like the opioid epidemic, antimicrobial resistance has been fueled by legal prescriptions from well-meaning healthcare providers including dentists. Tackling the problem requires a broad-based effort, said Kennedy, a board member of the Nonprofit Association for Dental Safety, ADS, who leads the group's efforts to prescribe antibiotics more judiciously, a practice known as antibiotic stewardship. Teaching people, right?
Mm-hmm.
Mm-hmm.
Teaching people about antibiotics is, you're a teacher.
Mm-hmm.
So let me ask you a question. When you teach, do you study before you teach? When you went to school, right? Yeah.
You prepare know your content.
Yes, and you want to make it, you're going to do something positive, right? When you teach, right? You want to give positive, yeah. So so the process, you study, what's your research?
And the most important things too, when you're teaching somebody on any topic, is letting them see both sides of it, right?
Okay.
Not just your one side. So it seems like that's what you're doing, is trying to bring awareness, like, hey, there's another side to this.
Yes.
That's what knowledge is.
Yes.
Right? And then you understand, and then when you have knowledge and understanding, then you can use wisdom.
Okay.
Right?
Right.
And say, is this wise for me, or and of course it's a case by case basis, but I know you're stressing, like, do I need this?
Yes.
Or are there other routes I can take?
It's like, do I need this sweet tea? It's gonna taste good, guaranteed. But I can deal with it. I've learned to stop drinking sweet tea and drink tea without sugar now.
Wow.
Yeah.
It's a process.
Yeah.
But I would say my tongue got used to it or whatever.
Yeah.
And I stopped drinking all the sugar.
Yeah.
It's a process. But there's a process to this too. I mean, you go to the dentist and you want to learn, hey, here's the process. I need to ask some questions.
Mm-hmm.
Yes.
What's best for me?
Yes.
Because you have a story, right?
Yeah. So like I said, maybe 2 months ago, I needed a dental procedure done, and the dentist I go to, my insurance was gonna cap out, right? And it's only 2026. It was early 2026, so I was like, okay, I have the rest of the year, or I wouldn't be able to use my insurance. So I went down to Mexico. I went to TJ. And there was a dental place that was recommended to me. Very good, great quality. I have nothing bad to say about the work that they did. A holistic place,
Okay.
really good. I mean, they used my own blood plasma to put into the gum there, and for healing and stuff. But on the way out,
Never heard of that.
yeah, so they even put me on a high dose vitamin C drip during it, so that for my immune system. Anyways, on the way out, they were giving me, like, okay, my next steps, and the dentist prescribed antibiotics to me, and he said, take these just in case, to avoid any infection.
Just in case was a good word.
Yeah, and any infection. And so I asked him, well, what are you giving me? And he said clindamycin. And right away the red light went on, like, whoa, hold on, because of everything you've been posting, Robert. And so I told him I don't want clindamycin. So he gave me amoxicillin. And I asked him, do you have any reservations about prescribing clindamycin and the side effects of it? And he wasn't aware of what we've been reading. He just goes, no. He goes, well, he told me, well, all antibiotics will, can bother your stomach. He goes, but that's why we recommend you have some food, take it with the meal. But he didn't know like the severity of it and everything, the stats that you're reading. So I went, but he was real cool about it. He said, look, if you don't want clindamycin, I can give you amoxicillin. He goes, you're the patient, it's up to you. And so I took the amoxicillin, but I didn't even finish,
So you're very proactive about your life.
Right.
Your health.
Right. But I wouldn't have known about clindamycin. And I don't like necessarily taking antibiotics anyways. One reason why I went to that dental place down there was because they use ozone therapy instead to kill the bacteria.
Okay.
So, and a lot of people in the mainstream aren't using ozone therapy. I wanted to read you something as I prepared for this podcast. This is from the National Library of Medicine. And it says, ozone therapy as a primary and sole treatment for acute bacterial infection. It says, the world is facing a crisis of antibiotic resistance, which impacts every treating physician on the planet. Thousands of patients die yearly in the USA from infections that have failed to respond to antibiotics.
Yeah.
Alarms have been ringing about bacterial infection fatality resurgence, the end of the antibiotic era, a calamity in progress. Ozone therapy has been used in medicine since World War I. However, it is not patentable and has suffered from lack of private source funding for research sufficient to have it accepted by the mainstream. Basic science, both in vivo and in vitro research, has found it to have several effects, including modulating the immune system, enhancing circulation, destroying microorganisms, including bacteria and viruses, and enhancing oxygen delivery and consumption by the body. It says this report presents a background, basic ozone science, and a case report of acute bacterial infection, tick bite cellulitis, which immediately responded to ozone therapy as the sole treatment. It says, and which fully resolved within 24 to 48 hours. Ozone therapy can be considered as an adjunctive or alternative therapy for bacterial infection.
Is that what they did to you?
Yeah.
Okay.
To reduce the infection. What the ozone does, it's like a molecule of ozone. It's O3 actually, and what it does is it destroys the cell wall of the bacteria, and they die.
Okay.
Wow.
So there's no type of resistance.
So
to
there's
that.
an alternative. To
There is an alternative.
Oh, wow.
Now you go on and it says the FDA hasn't approved
Yeah,
this
yeah, of
method
course.
and things like that, and but it says it's not patentable, so there's no funding to do more research. But I do know there's increasing an amount of dentists who are looking to this. My current dentist now, I brought that up to her, and she was like, you know what, I'm looking into that.
Wow,
That's something I might want to do.
Praise God.
But in Mexico they were already doing it.
Oh,
Wow.
we're a little ahead of us on something there.
Yeah.
So I went there, and so anyways, I thought that was quite interesting.
I'm glad you brought
to
that up,
bring
because I
up
didn't
because
know.
there is an alternative to destroy the bacteria in there. My niece, she had some oral surgery done, and she refused the antibiotic and just kept it clean with salt, right? She sprayed colloidal silver,
Okay. Yeah. I heard that.
on there, and then I think some food grade hydrogen peroxide, and she's done that twice now for 2 different infections, and it heals very nicely.
Well, I mean, I know nothing about what was the first one called again?
Ozone therapy.
Obviously, when you said ozone, I'm thinking about the sky.
Yeah, no.
You know,
Ozone.
so-
How do you spell it?
It's just OZONE, ozone therapy. If you look up
Okay.
O3, that's like it's a part of I don't know the exact science of it, but from what I read, it has to do with the oxygen molecule, and it's the antioxidant of the oxygen molecule that kills the bacteria.
Well, it sounds like something that's very, 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 very useful. So
Something to look into, at
yeah,
least.
something to look to,
or to
something
get more
we don't have-
educated
Yeah,
about.
something we don't have to take antibiotics. We use that. I didn't know the whole story. I know you told me a part about what you did, but I didn't know the whole story. I'm glad that you shared it now here on the podcast. Amen. So it
that's
says,
amazing.
anything you want to say, Gabriel?
Yeah, I just want to say that with your experience, the more information that you share with us, the more we have our audiences, are able to get better solutions and better options. It's not just about be aware of it and avoid it. It's like, okay, what other option do we have?
Yeah.
A better one. So I thank you for that. This is very valuable.
Yeah. Once again, you go to the dentist.
You mentioned if it's needed, right? Like if you need it. Like I didn't have. He said here, take this clindamycin just in case.
Yeah, that's what I was gonna say.
To prevent it, but as you mentioned, perhaps he could have said, do this instead, or I'm a very low case of having,
Right.
a reaction to that. So maybe do X, Y, and Z instead of the clindamycin.
Well, I do know they offer clindamycin to you if you're allergic to penicillin, but once again, in the articles, it says not everybody's allergic to penicillin. You need to take tests. Test yourself. You take a test if you're allergic to penicillin. Now, next time you go to the dentist, you don't need clindamycin. They'll give you something else.
Yeah.
So this is being proactive about your life, guys. We're all gonna go to the dentist at some point. teeth clean, teeth pulled. I think my mom, honestly, my mama had most of her teeth, 90-some% of her teeth still. She didn't have, she had all her teeth all up here. She took care of her teeth. I used to go buy some. She said, Robert, can you go give me some blah, blah, blah for my teeth? Yeah, I go buy it for her, right? Some Colgate or something, right? Because she was in the store. But I'm glad you brought that up. There's an alternative to some stuff. It's not patented, but that's a good idea. I hope somebody watches this podcast who's up there.
And there are dentists in the United States using ozone.
Oh, wow. We got see, this is what I'm talking about. This says Dentist Professional Society, state boards of dentistry, and patients all need to play a role. She said, this is like Erin Kennedy. And patients will need to play a role, she said, with enough will, the strategies that led healthcare providers to prescribe fewer addictive painkillers have the potential to transform how dentists use antibiotics. Antibiotic resistance impacts us all. Yes, it does, Candy said. The problem is so great that we're all called to action. Yes.
Yes, all of us call to action.
You're proactive.
Yeah.
You trusted it. You did something else. It worked out for you. You're proactive about your life. As we got to be proactive about dentists, the antibiotics we get from the dentist, doctors, whoever. How about our health? How we eat? What we eat? I just came over here and thank you, Lord. I had salmon and vegetables driving in my car. I didn't care. I said it spilled that out.
No.
But I try to stay on the fish, the salmon. That's when people say you lost a lot of weight. Yeah, what do you think? I stopped being on the hamburgers.
Yeah.
You know, and the cheese and everything else, and all the sweets.
I heard someone say, an herbalist, I think it was, he said, we don't have food anymore, we have merchandise.
Yeah, wow.
Right? Because our food is supposed to stay on the shelf for as long as it can so it can sell.
Right.
But we're not eating food, you know?
Yeah.
If we're made from the earth, we need to eat what the earth produces.
Yes.
So it says combating, you know something to say, Gabriel?
No.
It says combating similar epidemics. Dentists responded to the opioid epidemic by changing the way they prescribe a study published in 2021 found that the dental prescriptions for opioid pain medications dropped by 20% from 2012 to 2017. We learned that a simple 5-day course of Vicodin could lead to a lifelong addiction.
Wow.
Said Deborah Goff, farm. But they tried to get my mom. I think it was something in the hospital. I can't remember what it was. A whole pill. She said no, give me a little pill, because she didn't want to get addicted. She wanted a corner. She wanted to get addicted. It was for a headache.
So she was very careful.
Tylenol wasn't working no more. It was for a headache.
Yeah.
And they wanted to give her something stronger. She said no.
No. Oh wow.
Professor of pharmacy practice at the Ohio State University College of Pharmacy, referring to the powerful opioid painkiller once commonly prescribed by dentists, we have unlearned a bad habit. Dentists didn't change their opioid prescribing practices alone. All 50 states passed laws limiting opioid prescribing. Many redistricted initial opioid prescriptions to a maximum of 7 days in an effort to reduce the risk of addiction. States also created prescription drug monitoring programs. Listen, y'all. PDMP's electronic database that track uncontrolled substance prescriptions. Clinicians can use the database to learn whether patients have filled multiple opioid prescriptions, a potential red flag. So they started monitoring it. 50 states passed a law. We need 50 states. What did it say? 50 states? 50 states passed laws. So we need 50 states to pass laws on clindamycin. I say take it off the market, period. Or if you can't take it off the market, pass laws that the dentists and them need to, stuff like this.
It says limiting opioid prescribing. So maybe they could start limiting their clindamycin as well.
Yes. Because that's exactly what I'm trying to push right now, me and my family. If y'all can't take it off the market because it's too expensive, we're making a lot of money on this stuff, man.
Yeah.
Is it money? I don't know. That's what they say, right? We got to limit it. We got to work on this, guys. I know we all make our decisions in our life and all that. And like I said earlier, maybe we don't ask the pharmacists about this, but if they ever try to give you clindamycin, y'all got to start asking questions.
Yeah.
Ask questions for your parents. It affects the older people more than the younger. For your parents, 65 on up, they say it's kind of, I think, the worst. Certain ages. So for your parents,
I think it would have to do too with your overall health.
Yes.
Just are you healthy? Because some people can be 65 years old and strong as an ox.
Yeah. Yeah. So your health is, I'm sure your health is, but it says it really affects people of older age. So for your parents, for your uncle, for your Theo, for everybody. Ask the questions. Be on the side. You know, be with them. Something you want to say, Gabriel?
There's only one question I want to ask. Is your dentist, is your doctor interested in value or values? Do you understand the question? Value or values?
Right. Well, like I said, as he said earlier, maybe they're afraid of lawsuits. Who knows? Take this, take that. Okay. I'm not saying they are. Okay, you want me to take this, but is there something else I can take? Because I kind of read about clindamycin. I read about it in the article by SIDRAP, done by Liz Zabel, not only on SIDRAP, but it's on KFF Health News. It's on, if you go to Reddit and Google Dolores Owens clindamycin, it's got like 500 something arrows up, 80 people making comments on this stuff. It's moving, so you might want to check on this. I remember thinking we need to do this different, not just for her, but for everyone. In 2022, Congress passed the Medication Access and Training Expansion Act, or MATE Act, requiring clinicians who prescribe controlled substances to take 8 hours of continuing education on safe opioids. See, there it is right there. In 2022, Congress passed the Medication Access and Training Expansion Act, or MATE Act, requiring clinicians who prescribe controlled substances to take 8 hours of continuing education on safe opioid prescribing. Dennis, you got to need some education. You know, and I hope in education it says, do they really need it? Don't give it to your patients if they don't need it. I know you're offering it for a certain reason, but how about you just talk to your patients first and kind of tell them, well, we can use this. Be more informative, Dennis. Be more educational.
Yes.
With your
like a teacher.
Yes, like a teacher. So I'm saying be more educational, because I know for a fact, like I said, don't walk in and just say, okay, Dennis, my Dennis, I'll take it. My mama did that, and it's still gonna happen to her. Yeah. You know, she's been going to the same dentist for years. She trusted, right? Okay, I'll take it. And she took it. My brother had the same medicine a few weeks before. She took it, something like that. He had some side effects, but we didn't know how deep it was. We know how deep it was. So I'm going to be pushing this to the government legislation. I'll be working on this, and I would like to see them go to class. This is something that when they did this article, once again, the do's and don'ts. And when they did the article, they told me, Liz Zabel told me, there's going to be things in here that they can do to fix the problem, like this school, go classes, right? Be taught, you know. And once again, Liz Zabel, thank you for this. I appreciate that. And like opioid addiction, antibiotics resistance can destroy both individual lives and health of entire communities, said Goff, who also an infection disease specialist at Ohio State's Wexner Medical Center. Read that again. Like opioid addiction, antibiotic resistance can destroy both individual lives and the health of entire communities, said Goff, who also is an infection disease specialist at Ohio State's Wexner Medical Center. That's because drug-resistant microbes can easily spread from person to person and throughout hospitals and nursing homes. You can have an entire swath of the population that suddenly is resistant to a particular drug, said Purima Kumar, DDS, PhD, spokesperson for the American Dental Association.
Yeah. So
that's coming from the ADA. Yeah.
Straight up.
There's a lot in here in the Heart Association. I mean, it's a lot going on, bro. A lot going on. That's why I keep telling people, read the articles. Don't be afraid. Read it. Don't be afraid. You're gonna be like, wow. Like right now, you just said what you just said. Yes, it's in here.
Yeah.
Exactly.
As I told Liz Zabel before, I talked on the phone. I said, Liz, I might have said last time, there's no way in the world I could have got this information from these people. It's like you trying to feed maybe 500 people, but you don't have the connections. You ask me. I got the connections.
Right.
Yeah.
You be like, we don't know who you are. Me, I got friends who have food banks. You know, you guys know that I'm doing it for years. I can get you food for 100 people.
Yeah.
So, thank you, Liz. But
we got 2 minutes to wrap it up now. So, if there's anything that you want to share, Anthony, you know.
Yeah, I just wanted to say, like, it comes a lot. It has to do with awareness, you know, because I know Robert's been making a big effort into raising awareness, and I had it was almost surreal when I asked the dentist I saw, what antibiotic are you giving me? And he said, clindamycin, because I've been hearing that word from you, Ross, Robert, in the previous weeks. And so right away I was like, okay, red flag. Do you have something else? And I probably would have taken it had it not been for your awareness, and maybe it would have done nothing to me. Maybe I've been totally fine, or maybe not. But at least I had that choice. At least I knew, like, okay, let's not. I was aware of what your mother went through, and the statistics from the articles that you've sent me. So that's what I think we're trying to do right now, is just be aware.
And did you give that doctor the article that you?
I did actually. I did email the dental office the next day, and I attached the link to the article. So I don't know what they did with it.
I'm hoping they sent it to all the dentist friends.
Yeah,
I hope so too.
I don't know what they did with it, or if they even read it, but you can only do so much.
Well, they were like, I got to tell my friends what's going on now. There's something happening now. There's something out there. There's something out there that we know is going on for 40 years. It's time for us to tell you. So let me go over this real quick. Once again, foods to avoid when you're taking antibiotics: grapefruit, calcium fortified foods, alcohol and caffeine. Things you do want to do when you take any antibiotic is probiotics, fermented foods, cultured foods, live cultures, yogurt, prebiotics, high fiber foods, gut nourishing fiber. Get healthy diet, stuff like that you can take, because antibiotics, they mess with your stomach. They do a lot to you. That's why he said
that's what the dentist
so
told
eat
me.
some food. But like I said, does that mean you go eat a steak and some fries and a Coke and Pepsi?
Because the antibiotic doesn't know the difference between your good bacteria and the bacteria it's trying to kill. It's gonna
go at it.
Antibio. Bio means life, so antibiotic. It's gonna kill the good ones. That's why we're replenish the good bacteria with fermented foods, kefir, yogurt, sauerkraut.
All the good stuff,
prebiotics.
apples, all that is yes. You might say, I like that stuff, but you get used to eating it, y'all. Especially if you're going to take any antibiotics. But you know what? Thank you guys for another great podcast. Hope you guys follow these instructions and do a little more research for yourselves. And Anthony, bro.
Hey man,
It's been a while. Thank you for coming out.
Thanks for inviting me.
Very informative.
Thanks for inviting me.
Said some things that I really didn't know what it was. Like the atmosphere. What's it called again?
Ozone.
The ozone.
The ozone.
We appreciate you, man. And we'll get this out there, guys. And if you want to make any comments, let us know. You want to contact me or Gabriel, let us know what's going on, and I'll do our best to see how we can get back to you, and whatever I can answer, I'll answer. But I'm learning this stuff too, y'all. I'm still learning this stuff too, and the more and more I get in it, the more and more I want to know.
Yeah. If there's any more information that you guys have that could be very useful, like what Anthony just shared, please reach out to us. Send us your in an email or a text or whatever. So thank you guys for your support and for sticking out here with us.
And remember, let's all do better.
That's how we do better. God bless you guys.
See you later.
God bless.